introduce what's the limbal stem cell deficiency. It's an eye disease recognized by the lack of stem cells in the limbus, which has a vital role in the corneal epithelium repopulation to maintain superior function of the limbus. It causes partial or complete loss of regenerative ability of the cornea, corneal scarring, loss of normal corneal luster, and also conjunctivalization. There is many symptoms of limbal stem cell deficiency, including chronic conjunctival redness, poor epithelial wound healing, foreign body sensation, phobia, and so on. And also it causes positive fluorescein staining because of the corneal ulcers it caused. Limbal stem cell deficiency comes from two main factors, primary or secondary factor. Primary factors including aniridia, Turner syndrome, and so on. Secondary factors like Turner syndrome, such as chemical injuries or chronic inflammation. So there is a main problem facing limbal stem cell deficiency patients, and the main cause of blindness in Egypt is from the corneal blindness because of exposure to alkalis and acids in some industries. So its main treatment is by plastic surgery. But unfortunately, we're facing a main problem, a significant challenge in our institute, as the number of patients on the waiting list for this surgery increased year after year. Because they are waiting for the healthy corneal graft, which imported from the international corneal banks. So our main aim of work is to explore the potential therapeutic impact of bone marrow mesenchymal stem cells in treating limbal stem cell deficiency, which we will introduce it in experimental rats. This will come by investigating the influence of such a treatment in mitigating the inflammatory response, angiogenesis, and apoptosis, which accompany limbal stem cell deficiency. So first, in the methods, we use 66 mature female Western rats, which acquired from the Animal House of Research Institute of Ophthalmology. It accommodated individually in ventilating caging system at ambient temperature and humidity. Our experimental protocol is divided into three main groups: control, alkali burner group, and stem cells group. Control group is a normal, healthy rats. On day 0, they applied a subconjunctival injection of 4.1 mg phosphate saline per each eye. Alkali burner group for induction of limbal stem cell deficiency by sodium hydroxide. We induce it and then apply subconjunctival injection of 4.1 mg phosphate saline again. In stem cells group, we induce by alkali burn the limbal stem cell deficiency, and immediately we inject the subconjunctival injection of the first dose of mesenchymal stem cells by 2 million cells per rat eye. On day 2, we repeat the same process for the control group and for the alkali burner group, but without any further induction. We also we only subconjunctival inject 0.1 mg phosphate saline. And for stem cells group, we inject the second dose of mesenchymal stem cells. At day 7, the last day of the experiment, it's a sacrification day by overdose of 10% chloral hydrate. Our ophthalmology examination is done at our institute, as all rats were subjected to clinical follow-up using slit lamp to determine the score of the opacity and neovascularization, and also we determine the corneal ulcer by fluorescein staining. We detect the biochemical and molecular investigations also in our institute by determining the levels of inflammatory markers like tumor necrosis factor alpha and interleukin 8 by ELISA, and also mRNA expression of tumor necrosis factor alpha, nuclear factor kappa B, and COX-2 by RT-PCR. We determine the levels of angiogenesis markers like vascular enzyme growth factor and matrix epithelial proteinase 2 by ELISA, and finally we determine the mRNA expression of the apoptotic marker caspase-3 by RT-PCR. We determine the histological examinations as a pathology department at our institute to determine the effect of the alkali burn and the efficacy of the therapeutic impact of bone marrow mesenchymal stem cells on all the corneal layers. Our results, first, we want to be sure that the stem cells that we use is mesenchymal stem cells. So we determine the morphological structure first, as it's proliferate in spindle shaped and adhere to the bottom of the culture flask. And also we determine the mesenchymal stem cells surface markers by flow cytometry, as it get positive immune staining for CD105 and CD90, and the negative immune staining for CD34, which is hematopoietic stem cells surface marker. Our clinical ophthalmology, we can observe at alkali-Berne group. At alkali-Berne group at day 0, there is central corneal haziness and irregularity in the corneal surface as compared to the control group. On day 2, there is opacity and neovascularization of grade 4, and on day 7, the diameter of the opacity increased. But in stem cells group at the same day of induction at day 0, also there is a central corneal haziness, but after 2 days, still there is some opacity, but without any irregularity in the corneal surface. On day 7, there is an absence of neovascularization and opacity, and the cornea retained its normal structure again as compared to the alkali-Berne group on the same day. By determining the corneal ulcer by fluorescein strips, we can detect on day 0 there is a huge corneal ulcer all over the diameter of the cornea as compared to the control group. And on day 7, the diameter decreased, but it became more deep in the corneal surface, in the corneal layers. In stem cells group, we have the same observation of the alkali-Berne on day 0, but we can note that on day 7 plus day of the experiment, there is an absence, complete absence of the corneal ulcer after taking the 2 doses of mesenchymal stem cells. Our biochemical finding, we can determine the inflammatory markers, human necrosis factor alpha and interleukin 8. There is a significant increase in their levels after alkali-Berne, after induction of limbal stem cell deficiency. But in stem cells group, there is a significant decrease in their levels. Also, by determining the mRNA expression of inflammatory markers, human necrosis factor alpha, nuclear factor kappa B, and COX-2, there is a significant increase in their levels and significant decrease after stem cells injection. Angiogenesis marker also, we have the same results as it increased in alkali-Berne group and it significantly decreased after stem cell injection. Cascade 3 also gets the same results as it decreased significantly in stem cells group after it being increased significantly in alkali-Berne group. So we can conclude that mesenchymal stem cells exert its anti-inflammatory, anti-angiogenic, and anti-apoptotic effect to treat limbal stem cell deficiency. Histological examination, we can note that there is hyperkeratosis and dyscrotic infiltrate in the epithelial layer, and also there is an infected infiltrate, edema, and fibroblast in the stroma as a result of inflammation. Also, we can note some blood vessels appeared because of the invasion of the conjunctival cells over the corneal surface. Also, we can note some acantholysis in the epithelial layer, and also there is an invasion of the conjunctival cells all over the corneal epithelium. Okay, after stem cells injection, we can note that the epithelium layer is completely clear from any acantholysis, sclerotic infiltrate, or hyperkeratosis, and there is a mild lymphotic infiltrate in the stroma. So we can conclude that the mesenchymal stem cells return the normal structure of the corneal layers again. So we can conclude that subconjunctival injection of bone marrow mesenchymal stem cells offers a promising treatment for limbal stem cell deficiency by reconstruction of damaged corneal epithelium and acceleration of corneal wound healing. Also, there is an ongoing clinical trials focusing on the treating the ocular diseases like severe ocular burns, facilitating epithelial healing in corneal epithelium defects, treating dry eye disorder associated with GVHD, and treating dry eye disease secondary to Sjogren's syndrome. So, mesenchymal stem cells therapy hold a significant potential for treating wide range of ocular diseases. However, the further research is needed for the development of the using mesenchymal stem cells exosome and using mesenchymal stem cells development by gene expression for giving better results for all ocular diseases. Thank you.